welcome everyone. This is the last in the current suite of NHS Research Scotland webinars on research in older adults. So thank you all for joining. I'm Terry Quinn, so I am the NRS Ageing Lead for Scotland. Now, since we're all friends, I'm just going to be completely straight with you. I'm not having a great day. I'm at home because I've not been well, and my laptop broke this morning, so I'm doing this all on my phone. So the lovely presentation that I'd made with an update on what's happening in Scottish research unfortunately has been lost in cyberspace. So I won't give you that. I may be able to add it in later because we will record this talk and we will put it on our website. But I propose that what we do is we get straight to the main event, which is the bit that you've all tuned in for, which is Professor Susan Shenkin. So Susan will be known, I'm sure, to many of you on the call. She is Professor and Honorary NHS Consultant in Edinburgh. She has a portfolio that spans lots of different things, including epidemiology, systematic review, but the topic that she's going to speak on today is around care homes. So we're going to use the usual structure that we have for these meetings. Susan will give her talk and then we'll open things up to Q&A. While Susan is talking, if you could all just keep your cameras and microphones off, and then when we open up to Q&A, we can have a bit of a discussion. So with that, thank you again for joining, and I'll hand over to Susan.
Thanks very much, Terry, and really lovely to see so many of you joining the call, and many people who I think will know some of this already and many of whom may not. But very happy to answer any questions or queries at the end and provide more information as you'd like. As Terry says, this will be recorded, and I'm very happy to engage with people offline as well if that would be helpful. So for technological reasons, Jackie very kindly is going to share my slides. So I'll let you pull those up now, Jackie, if you can. Thank you very much. And we can just start from the beginning. So as Terry said, I am Professor of Healthcare for Older People, University of Edinburgh, part of the Department for Ageing and Health and also the Advanced Care Research Centre at the Usher Institute. And I'm here in my role as co-chair of ENRICH Scotland, and the website for that is at the bottom of the first slide. And if you just Google ENRICH Scotland, you will come to our website as well, which will tell you lots of what you need to know. Next slide, thanks. So this is a lovely video which I can't show for technology issues. I'm at the NHS hospital today and that causes a problem. But this was a video that was recorded in one of our partner care homes in Fife, Abbotsford Care Home, and it just tells you a little bit about what ENRICH is and what that means. And you can find it, yes, exactly. Jackie's bringing up the website there, and I'll put the link in the chat. The video is there on the website. You're going to try playing it then, Jackie, just to see if it works.
Welcome to Wraith Manor. This is just one of over 1,000 care homes in Scotland who are leading the way in research, supported by ENRICH Scotland, enabling research in care homes. We promote and support research in partnership with care homes across the country. We're working together towards the goal of improving the lives of residents, their families, and the dedicated staff who care for them. Research plays a crucial role in identifying best practices and putting them into place to provide the best possible care. By understanding the unique needs of care home residents and staff, we can make informed decisions that lead to positive change.
It's just about improving the quality of the residents, the staff and the relatives' journey through care. Just making it more accessible for people, finding out what works, what doesn't work. But it's just about involving everybody.
I came here just after Christmas. I enjoyed it. I wasn't looking forward to it to begin with, as my daughter got it arranged. But it's been great.
I like it here. People are very friendly. Staff are good.
You get a laugh with them, and you get a laugh at us.
I think research is important for better quality of life of the residents, getting them to experience more things, getting relatives more involved, and finding out that residents like something that they didn't even know they were interested in. In my head, research in a care home would be just sitting, having a chat, having a cup of tea, having a cake.
Residents coming into here could be quite stressful, so you might want to know a bit of background about these residents, things they've done at home, their past hobbies, jobs that they used to do, little things that can help them settle into the care home as well.
The research I would like to see for the future is more around how we can make the transition from home to a care home setting a little bit better. To help us do research in care homes, it's just about communicating with us. We're very willing to take part in any research that you have going on. If we can help, we will.
As you can see, research in care homes is simple to take part in and makes positive change happen. There are opportunities for everyone, residents, families and staff. We at ENRICH Scotland will continue to work to make a lasting impact together.
Next slide, thanks, Jackie. So, what is ENRICH Scotland? What do we do? We're bringing together care home staff, residents and researchers to design and deliver research and to improve the quality of life, treatments and care for all the residents and the staff who care for them. And we have several parts to ENRICH Scotland, which has at its heart rich voices. And the logo there was designed in collaboration with one of our care home manager partners who designed that, Kirsty Carton. And that emblem shows that Rich Voices and Patient and Public Involvement is Rich Voices, the name of our Patient Public Involvement arm, are at the heart of ENRICH and everything that we do. And I'm going to go through the different parts of it: the Research Ready Care Home Network, the Care Home Researchers Forum, the Care Home Managers Forum, and the other aspects of ENRICH Scotland, which haven't come out very well on that slide, apologies. Next one, please. Thanks, Jackie. So we have a large team now, which has been very kindly funded by the Chief Scientist Office since 2021, which has allowed us to really develop the support that we can give to care home research throughout Scotland. And I co-chair that with Dr. Emma Law, who some of you may know as from the Neuroprogressive and Dementia Network also. The senior management team includes Irina McLean, who's our health and social care lead, Anna Crawford and Rosie Ashworth, who lead on the patient and public involvement, Maria Drummond, who's a senior clinical studies officer and a registered nurse, and Helen Davidson, who provides administration support. And importantly, we have clinical studies officers throughout Scotland now to support the recruitment of people to trials for any care home research in your area. So you can have a local person to contact if you are wanting to do a study in any region of Scotland, and I think that's a really important part of the delivery that we want to do throughout the whole country. Next one, thanks. So as I said, the core part of ENRICH Scotland is our patient and public involvement arm. PPI isn't a really very good term when you're thinking about care home, so the group themselves named themselves Rich Voices, Research in Care Home Voices. This is the voice of people living and working in care homes, and includes both residents, their families, and people working in care homes as well. The core team of Rich Voices, which include people with lived experience, they will review requests for PPI in care home research, and they do that with fortnightly online meetings, which are supported by our PPI staff. And the clinical studies officers will work with local care homes to support any activities, and some of the things that people may perceive as research has actually been early PPI work that they've done to develop research activities. We've co-created with the PPI, with Rich Voices group, the film that I mentioned, also a podcast explaining what research in care homes is, which should be out for you to listen to in the autumn. And if you go to our website, you'll see that there is a section there relevant to the Rich Voices group, which they have developed a very accessible lay summaries of research, and we're co-creating these summaries of all the research that we do to make sure that people can really understand the work that's going on. So the work that the Rich Voices group have said they'd like us to focus on in the future is about better getting to know the care homes that we partner with and what care homes need from us to understand how to take part in research. And you can look at that website there to get a bit more detail on that. Next one, thanks. And we're really proud now that over about a third of the care homes in Scotland are now signed up as research ready. And this is various different care home managers from across Scotland proudly showing the certificate that they get when they sign up as research ready. This certificate is endorsed by the Care Inspectorate. And the care homes are really proud of having that to display and to show that they are willing and able to hear about research and to partner with us in developing or taking part in a project. It doesn't mean that they have any specific research skills. It just means that they're willing to hear about it and to consider taking part with appropriate support. But it's really great to have that number of care homes who are willing to take part. And as you can see, it includes remote and rural areas and places not just in the central belt of Scotland. Next slide. The other arm to ENRICH Scotland is our care home innovation partnerships. We have and that's their logo, the CHIP logo that looks like a nice tree with strong roots and branches, because we are rooted in research, but we're building branches collaboratively working between researchers and care home staff. There's one group in Lothian, which is mostly privately funded or not-for-profit care homes, and one group in Glasgow, which is mostly local authority health and social care partnership care homes, which don't have nurses resident in the homes. And we work together to build relationships for them to make suggestions for future research, to work with us to develop our research ideas, and to help us to deliver and develop those ideas as well. And it's been a really great partnership. It includes not just research, but some quality improvement methodology as well. And we've worked together to do a wide range of different things, including testing of robotics in one of our local care home. We co-developed the online supportive conversations and reflections that happened with care homes over COVID. And it's been a way of really tapping into what's important to care home staff at the moment. And that is what led to us having a focus on care home staff recruitment and retention with our current work, as that was what the CHIP said was the real priority for them coming out of COVID. And a key part of the CHIP membership has been the support that the members feel with each other, particularly in the Edinburgh group, which I'm part of. It's 6 care homes. And they really do know each other well now. They ask each other lots of questions and do lots of support informally. And I think creating these small micro networks of care homes is a really important lesson to show how that can work, not just for their own support, but then to generate research ideas and try and answer them and then disseminate best practice. So we are keen to develop more of these CHIP partnerships in different parts of the country if there is a demand for that from the local care homes. Next slide, thanks. So we have 2 fora attached to ENRICH. One is for care home managers, and that's an online meeting every 2 months where care home managers with a passion for research and evidence-based care meet to share their ideas and innovations. And if you're interested in being part of that or advertising that more widely, we can send you the programme and you can sign up to that. It's really a great way for managers to learn a bit more about what research means, how simple it can be for them to take part and to make sure that they share what they're learning from the research that they've been participating in. Next one. And then we have a forum for researchers as well. They are any researcher from throughout Scotland who's interested in care homes. To be fair, I don't think it would be limited to Scotland either. We would, but at the moment has been focused on Scotland. Those that are interested in care homes, and it allows us to access peer support and to collaborate, to share knowledge, stop us making the same mistakes again, and to help each other to find the best solutions for research working in the social care space, which, as you know, can be very complicated and doesn't follow the same processes as research in NHS or in other aspects of health. So these are online meetings, have been quarterly since COVID, although pre-COVID they were in person, and we may move to some in-person ones again. So if anybody who's on the call would like to be part of our Care Home Researchers Forum, you can sign up for that by getting in touch with us through the website or contact me directly. Next slide, thanks. And this is just to emphasise that research teams taking part in care home research are across the whole of Scotland, and we are also collaborating with many colleagues in England as well. So I think there is an explosion really of care home research as people realise how important it is to participate in research, both that includes the large numbers of people who have high health and social care needs throughout the whole of the UK and beyond. Next one, thanks. So what kinds of research do we support in ENRICH Scotland? Well, we really want to support anything that goes on in care homes that could be seen as research. We don't really have a remit for quality improvement, but we can collaborate with our quality improvement colleagues in the NHS to make sure that research and QI are speaking to the same important questions and the right methodology is used for the right question. But this decision tree, if you like, just is to describe all the different kinds of study designs that there can be, looking at descriptive designs of surveys and qualitative study, which I have to say is probably the majority of what we've done so far. But we are really keen in developing it into analytic methods, including observational cohort studies and interventional studies like randomized trials or other types of trial design, and how these can be delivered in the care home environment, which is something that we're working really hard on in Scotland and throughout the UK actually with colleagues. And I think it's really important that we start to develop that infrastructure so that trials can really happen. We had an opportunity to try and take part in a trial called Protect CH, which was led by Philip Bath and Adam Gordon. And that was during COVID, trying to develop to use medications that would be effective in care homes for people who were exposed to COVID. Now, because of the vaccines, that trial never happened, but a lot of work was done in trying to set up the ethics, governance and practicalities of that. So we're learning a lot in this area. And I think we need to really continue to learn those lessons to make sure we can do things as they need to happen and we don't have to reinvent those lessons every time. Next one, thanks. So I just wanted to give you a sense of some of the studies and the sorts of things that we've been taking part in already. This is a long list of a few different things just to show that we have used qualitative methodology. Jenny Burton in Glasgow listened to care home staff experiences from COVID. We did a survey led by Lucy Johnson from Napier University, looking at whether care homes, how ready they were for data and digital transformation, and showing that the majority are still collecting information on paper and the complexities that poses when you're trying to share data about residents externally. We were involved in the co-design of Dr. Aisha McGregor's study looking at needs rounds of palliative care in the last years of life. We took part in a survey and qualitative methodologies looking at psychological first aid for workers. We did some co-design and a survey looking at skin hygiene care in care homes, which is a very practical study relevant to the care of the residents. We did an observational mixed methods study to support the provision of palliative care and end of life, led from Professor Sleeman in London, and did a mixed methods evaluation about connecting residents in care homes, led by Grant Gibson from Stirling during COVID, and a qualitative study which we're writing up at the moment, involving looking at understanding the retention and recruitment of care home staff by Maria Drummond and Lucy Johnson, which is we're writing up that paper at the moment. Next one. So really just to show you that mostly they are qualitative studies, surveys, but that there is a range of topic areas, although so far it's mostly been focusing on care home staff. So just wanted to give the example of the churn study, because this was a really nice partnership between ENRICH Scotland, Edinburgh Napier University and NHS Lothian. The clinical studies officers from ENRICH interviewed 10 managers and supported by Napier University also. And the summary of our findings is that to try and reduce the churn of care home staff, that there really is a combination of factors, that there is a perfect storm of issues that come up at the same time, that we really need to try and move upstream in the process to try and improve retention, and that we need to support staff to keep them on board during the difficult times that they have in care homes, and how important it is to have the structure and support in the care home to make that happen. But that's just a sneak preview of the results. The full paper will be coming out and we'll get more detail on that. And Lucy, I think, is on the call, actually, could answer your questions about that if you're interested in the specifics. But just to show that ENRICH Scotland is keen to be collaborative, work with universities and with NHS bodies to answer important research questions relating to residents and staff. Next slide, thanks. So we have looked at a range of different things. One thing we've been very interested in is prioritisation, which is definitely not how you spell that. Anyway, some of the studies are about how do we know what care home staff want us to, and residents want us to do research into. So how do we understand what it is that they would think is important, and how can we best do those studies to meet those needs? So we collaborated with colleagues in Leeds to do this Search U study, where we have asked staff, residents and relatives about what they think are the key uncertainties that can be answered and we could prioritise research for in the future, so that we can go back to funding bodies and say this is really what we should be working on now. And we also did helped with a survey to look at palliative and end-of-life research priorities. But we have targeted studies that need targeted recruitment, such as recruiting people to discuss rights-based concepts in care homes, looking at enhanced access to green space, and looking at improving communication tools and expression of intimacy in care homes, which is a really important and under-researched topic. But another area that we're really keen that care home residents are not excluded from studies which are not designed with care homes specifically in mind, but where just because you live in a care home doesn't mean you shouldn't be able to take part. So for example, in this study of exploring drug use in later life, we opened recruitment to care home residents and staff to say they could take part because they are members of the community like everyone else. So we're also open to recruitment for non-care home specific research. Next one, thanks. And as I say, as well as research from established researchers, we've supported several student projects. This project by Huda Kaduri, who's an intercalating medical student in the University of Edinburgh, helped us to do some work on prioritising research topics, and she helped to analyse a short survey that we send out to care home managers when they sign up as research ready, to ask them what their main areas of interest are. And her analysis showed that the main things people were interested in finding out more answers to questions from was palliative and end-of-life care, activities for residents, how to care for people with dementia, how to support staff well-being, and managing stress and distress, which I guess overlaps with the caring for people with dementia. So we're starting to develop what we feel people are telling us are the main research topics to explore in the future. And we also developed this by doing a session with the participants in the Neuroprogressive and Dementia Network conference in Dundee last week, where we did a session with people taking part in the conference to ask them what their research priorities are. So I think at the end of today, maybe Terry, you could share the link to the Scottish Dementia Research Consortium website where the slides and the outputs from that meeting will be presented, and you can catch up with that as well, because those topics may be relevant and interesting to you all as well. Next slide, thanks. So what are our future plans in ENRICH Scotland? Well, we are wanting to improve our communication to make sure we target it really well to care home managers who are interested in specific topics, so that we give them ideas and opportunities that are relevant to them. Obviously, everybody gets too many emails, so we have a regular newsletter that you can sign up to, but we want to also make sure people get targeted opportunities that they will be interested in. Along with Rich Voices, we are continuing to co-design a lot of research, and all of you attending the call, I'm really keen that if you are interested in developing ideas, that you contact us early so that we can use the Rich Voices group to co-design your research and to make sure the voice of experience is really embedded in that from the beginning, both generating and answering research questions. We really want to improve our working with underserved groups in care homes, promoting the research-ready care homes in remote and rural areas, but also making sure the needs of other underserved communities who are living in care homes, particularly ethnic minorities and LGBTQ+ plus community are well met as part of care home research also, and making sure that we have a wide representation from areas of different levels of deprivation, and that we can support all care homes that are willing and able to take part in research. As our studies officers develop more expertise, they're all registered nurses, they all have experience of working in research studies, including trials, so they are very keen to carry out more data collection and support a wide range of study designs as far as our capacity will allow. So definitely keen to take part in that, and we are keen to use data-driven innovation approaches as well, and some work going on to see if we can establish the ethics and governance framework to move data from care homes into a trusted research environment, so as we can link that with people's healthcare data, which sounds simple but really isn't. So part of our work going forward in the next couple of years is going to be really to develop the ethics and governance pathways to make sure that social care and care home research, as an exemplar of that, has a clear pathway in the way that the NHS pathway is at the moment, because some of these pathways don't work the same in social care, and they don't work the same in all the 4 countries across the UK either. Next slide, thanks. And you know, we get this chance to blow our own trumpet, so it's just nice to share with you some of the lovely feedback that we've had from both staff and residents taking part in research studies. And I think it reflects the idea that sometimes people didn't really know what research was. And if you watch the video, you'll see that one of the care home staff says, you know, research can be sitting, having a cup of tea, having a cake, having a chat. And I think getting over that message that research isn't somebody in a lab coat looking down a slide, but can be something fairly straightforward, has really broken down some of the stigma around what care home research is and how simple it can be for them to take part. And the residents have said, you know, it gives them a purpose, it gives them reason for doing something, and they've enjoyed taking part, but that we shouldn't underestimate the fact that having the recognition from the Care Inspectorate endorsed certificate supports the staff, and they really like the fact that it is something that they can show back to the Care Inspectorate to say this is something that we are interested in, and makes us stand out as a care home. Next one, thanks. And researchers as well have given us some positive feedback. This was the study looking at research priorities, where our studies officers went out and spoke to care home residents, and they really felt that we'd help to improve the recruitment. And I think because we have a relatively small team and a relatively small footprint here in Scotland, that we have very close relationships with our local care homes. So hopefully that does improve recruitment to studies. Thanks. Next one. So you can probably think of lots of reasons why it might help a care home resident to have access to research. It allows them to identify areas that they're concerned about, and they can be partners in research, not just subjects, because they can sign up to be part of Rich Voices, and families can also do so if they want to participate and have a voice in the development of research. As you know, anybody that's taking part in a study or a trial can have early access to some of the treatments, and this can lead to improved outcomes or improved quality of life. But overall, I think mainly people like the sense of purpose, the meeting new people, gaining confidence, and having hope in the future, because often, as you know, care homes are seen as a place of last resort, as somewhere don't put me in a home. And I don't know if you saw in the Father's Day cards recently that are, am I your favourite child? Yes, or no, here's the care home I've chose you. Some of the rhetoric that comes out of some gift cards, advertising with very negative perceptions of care homes really make it difficult for us to continue to create this positive image and to try and support people, acknowledging that these are difficult decisions and that people moving into care homes are doing that because of the complexity of their health and health needs, but that we do need to think carefully about how we can make that feel like not always a negative decision. Next one, thanks. So just a few things for you to think about, and we can maybe pick up in discussion and questions. How could ENRICH Scotland help you in your work, in your research, for your families, for your friends. If you were a care home resident, because it's very likely that many of us will be, would you want to take part in research? How do we make that happen? At the moment, when you move into a care home, there's no way for you to express in advance whether you would want to take part in a research study. And then if you lose capacity to consent and you haven't talked about it to your family, they may not give you the opportunity to take part, even if you wanted to. And that could include things as simple as sharing your data. So would you want to do that? And if so, how do we make sure that those wishes are honoured? And if somebody asked you what topic and research methods would you want to explore in a care home setting, what would you say, and how could ENRICH Scotland help to make that happen and make the case to the funders that those are areas that should be prioritised? And how do we work together to develop the ethics and governance framework to be inclusive of care home and wider social care research? And you know, I'm a doctor, I'm a geriatrician, I'm a healthcare worker, and so moving into this space, I've realised the differences and challenges of the different processes across health and social care. And even though we're supposed to be in an integrated system, sometimes it doesn't feel so integrated. And also to think about the differences between research, innovation, and quality improvement, that the processes can be so different, and that makes it very complex and difficult for people working at the intersections between these spaces. So I think it's really important that we have a one-stop shop that can help us to understand the best way to navigate those processes. And of course, you'll be aware that probably over 2/3 of care home residents have dementia or some degree of cognitive impairment, and that certainly has implications for participation in research, for how we gain consent, how we make sure that we are doing things with an appropriate ethics framework that people would have wanted had they had the capacity to consent. Next slide, thanks. So really my take-home message is just this: think care home research, think ENRICH. For Scotland, there's also branches in England and in Wales, but that we were trying to be the one-stop shop where if you're thinking of doing a care home research study, if you come to us, we can hopefully provide advice, support, or signpost you on appropriately. And next slide, thanks. And this is just the all the ways to contact us. So the website is your main place where you can find all the information and links on to how to apply to us for support or anything else. So thank you very much, and I'm keen to hear your comments, questions, queries, other thoughts. Thank you.
Okay, so we can stop sharing slides now, and we can all look at each other. There we are. So thank you. I thought that was fantastic. I'll just pick up on one of the things you mentioned, and that was the prioritisation exercise that we did at the meeting in Dundee. So the NIHR, who are one of the main funders of research in the UK, have a process for getting those ideas that then lead to a commissioned research call. And part of that process is that they ask groups with a special interest to submit questions. And so an ask went out to all of the NHS Research Scotland groups if they wanted to help with that. And Tom Russ and Susie and I have been working together on that, really thinking about older adults and brain health as a theme. So we have been collating questions through lots of different platforms. We've been collating questions online. We had a very successful exercise at a meeting where people generated some questions, but we're still open for more questions. So it's not quite ready yet, but I think in the next week or two, if you go to the Scottish Dementia Research Consortium website, you will see a list of the questions that we have gathered so far, and there'll also be an option to submit questions. So watch this space, and we'll keep you up to date with that. So we'll open things up for questions. I'll I'll maybe start if I may, and then we'll see if other people have questions. So Chris Whitty's annual report last year was all about older adults. And one of the main recommendations was that it was completely unfair that older adults are systematically excluded from research, either through protocols or just through decisions of PIs. And people have said, I mean, I think we'd all agree that that's not fair, but people have said there's no reason that someone in a care home can't be, you know, enrolled into an industry clinical trial of a new drug. And I agree with that in theory. I think in practice that could sometimes be difficult. I wonder what your thoughts are on that.
Yeah, absolutely. I mean, I think there's two things, isn't there? There's about knowing what people's wishes are and if they have consent to take part in things, and if they wanted to do that, they should have the opportunity to do so. But you need the infrastructure and the logistics to be there to deliver a trial, to provide the medication, to transport it in a safe way if the care home happens to be in Stornoway or whatever. And then if the person can take a medicine independently, and how does the care home staff make sure that they provide that alongside the other medication that they're giving, and so on. So I think that it is a important thing to say, and I think we should say it as an option, but it may be a more challenging thing to deliver in the practicalities. But until we give people the option and try and do it, we can't test it to see if it works. So I think that I'm definitely up for the challenge, and would want to try and support it. But I think we do need to make sure, because it's not just an individual being in their own home. We do need to think about the other residents, the burden, the impact it has on staff, the training, and so on, about giving a medication, and how we get accurate outcome data, and so on. So I think yes, but with caution, and appropriate resource, I think, needs to be given to the homes to support that as well. Yeah. I don't know if you can see online, Terry, but there are some hands up, so you might not be. I think you said you maybe can't see.
Yeah. So for those that missed my griping at the beginning of the session, my laptop blue screened not long before we started, so I'm having to do this on my phone. So I can't see who's got hands up. So I wonder actually if you can just help me there.
No problem. So Professor Louise Phillips, you got your hands up first.
Oh, hi, thank you. Yes, that horrible blue screen always makes your heart sink at that point. Oh my God. Thank you. That was so interesting and really useful to hear about. And I guess I might have missed this, apologies, but I just wondered what your thoughts are on, if you're trying to do any research that involves care homes, then you're having to navigate often thinking about NHS, council, private. And I just wondered what your thoughts are around that. I mean, I have to say that sometimes we've decided that we wouldn't go anywhere near NHS care homes so that we don't have to go through the hell of NHS ethics, when it's not something that's terribly complicated. But I just wonder what your thoughts were around that and how to navigate all of that.
Yeah, no, it's a real issue, and I think Aberdeen's the only place in Scotland that's left with NHS care homes, actually. So yeah, the rest of us, I think, is health and social care partnership homes or privately funded ones. But you're right, you don't want to exclude people because of who happens to own their care home, right? But there are currently these probably three separate routes for applying for ethical approval, which either through the NHS, through the universities, as if somebody's living in their own home, or potentially through local councils, which is a route that none of us really have used because the pathway isn't really there. So Irina McLean, who's part of our team, has been working to try and develop this infrastructure with the CSO for some time, but it's not been without its challenges to try and do that. But if you would, we can certainly keep you up to date with where we are with that, and I'm happy to keep people up to speed with that. I think as one of the things that we want to do is ENRICH is to continue to lobby for the the need for a much more streamlined pathway and representation from social care on the NHS ethics committees. Oh, Irina's here! Hurrah! Didn't see that you were here. So yeah, because the ethics committees don't have social care representation at the moment. I'll let Irina answer the question. Well, Irina, you could introduce yourself for people here that don't know who you are and what you do, and then you can answer that.
Thank you, Susie. Yes, my name is Irina McLean and I support everything social care research governance for NHS Research Scotland. So interestingly, the ask said, and as Susie indicated, there are very few of those we have issue with in terms of where we need to think about that feasibility of the project potentially. But luckily, things are moving. I can't say they move quickly, but they move swiftly. Susie, myself, and Lucy Johnston contributed to the big care home data review, which has happened in Scotland, and ethics is on the radar. And the actual ethics chapter has not been published yet, so we can't talk about it publicly. But there will be a lot of interesting recommendations, and we are hoping to move on with this development, and also conversations we are having with HRA in terms of where social care ethics and of course care home ethics sits in Scotland. That's another layer of our work, but unfortunately we need to think about this on a bigger scale, and that's not just ethics, but when it comes to excess treatment costs as well, when it's NHS-led study and we're talking about non-NHS sites. Unfortunately, Scotland is not in that privileged position to contribute to non-NHS run studies, so we have to think about it in a complexity of things. So it's not just NHS run, non-NHS run care homes. It's so many things which don't correlate especially when a big pilot study comes from UK level study comes to Scotland. We have to be aware of these things as well. But yeah, things are happening, and they're not quick by any stretch of imagination. But yes, I think we would be happy to keep people updated. And also, I think that care home data review, we are hoping that things will be moving on the national level, I'm talking Scotland wide, to address this issue. Thank you.
Does that answer your question, Louise? Anything else you want to come back on with that?
Thanks. I mean, if I could come back on, I mean, that's
I see Rose has got her hand up, but we've got time, so it's fine. Yeah.
If you're sure. No, I was just going to say that all sounds promising, but it's so important that ethical review is proportionate, I guess, would be the point that I would want to make, because it's very different if you're asking people to take a novel drug as opposed to wanting to go and interview them about the experiences that they've had. Those are just such radically different things that I think it's so important that ethics review is proportionate and that we're not always looking at the worst case possible scenario. I mean, I know that's obvious, but I do think it sometimes gets a bit lost sometimes. And in relation to that point, the other point I was just going to make was the one surrounding capacity. And I wondered if there was any, whether there was any proposals to think about that in a bit more detail as well, because certainly in the past, doing research for people who don't have capacity has been so almost impossible virtually. And again, I think it's about the proportionate issues. Of course, if you're asking people to take a novel drug, not having capacity is really complicated. But if you're actually wanting to come and speak to people and ask them some questions about something and they're able to answer and contribute, I kind of feel like those people are excluded from research in effect because it's almost impossible to get the ethics to. And so I just wondered if there are any thoughts around that issue, basically.
Yeah, you're speaking our language. These are all things that we've been talking about and grappling with for some time, and are very aware of it. The proportionality of the ethics is something that we're very aware of, and certainly I've been looking at just moving data between the care home and trusted research environment, and people talking about having to go to NHS ENRICH to transfer one person's data to do that. The proportionality is really important, but we are again working on that, and I'll get Irina to come in about the AWI thing as well in a second. But yes, I think the ethics committees are becoming a little bit more sympathetic to the view that if research needs to be done, not excluding people who lack capacity, then we have had some cases where that has been able to be included, and because saying you can't do care home research including people who lack capacity, because then it's not relevant and it's not extrapolatable, and we have got some precedent for doing that now. So I think that's why it's important that we talk together and share those experiences to make sure that if somebody else is then applying, that we can use precedent from each other to say, you said this last time, can we not just use this precedent to do that again? Exactly as you say. But these are all really important, which is why there is a review of the AWI legislation and how that is going to impact on research. So Irina, do you want to give an update on where that's at?
Yeah, so there are actually 2 points. One, which is promising, is GAFREC update on roles for Research Ethics Committee membership. So I don't know if you're aware of that, Lewis, it's expert, lay and lay plus. So they will be looked at in a broader sense of recruiting panel members, which actually now includes care as a area of expertise. So yes, HRA is looking at that in a wider sense. In terms of AWI legislation is related to research, is going for national consultation. Hopefully will be going live in the middle of July. So we're just finalising. It is sitting with the legal team within the Scottish Government. So hopefully that will be able to simplify processes. And again, it's not open and out. So there are several exciting things which have been proposed. But just, look out for that. The consultation is going live. We have last meeting tomorrow, I think, and then it's just in lawyers' hands when it's all signed off, so there can be people can express their opinions. And I think that's what Susie said. It's actually being able to give that constructive feedback to colleagues and ethics as well, because sometimes it's not fair on them, because the amount of clinical skill which has been just normalized, institutionalized in this type of establishments, now with social care and non-clinical research becoming more obvious and more prevalent, especially in care home environments. I think colleagues from places like R&Ds and RECs, they do need a lot of support, with being flooded with this, something a bit of comfort zone. So I'm hoping 2 things, GAFREC review of terms of conditions and roles, and AWI legislation. So 2 things which hopefully will move things a bit forward.
Thanks loads for all your answers. That's brilliant.
Great. Thanks. Good questions, Louise. That's great.
I'll maybe just jump in wearing my Vice Chair of Ethics at University of Glasgow. I mean, a while ago, I said, we really need to think about care homes, and the response I got was, let's not go there because we never get any applications. So there's a little bit of chicken and egg. The applications need to come in, and if you're the first person putting them in, there will be a bit of pain because the ethics committees do need to learn, but you need to show that there's a need for them to learn. So I would encourage people to get applications. I realise I'm now creating work for myself.
Well, it's helpful, but I suppose oftentimes when people are putting them in, because it's including people who lack capacity, it's having to go to the AREC, which is probably why they don't come to the local ones. So that might be why you don't see them, and maybe that's not. Perhaps we don't need to upskill all of the committees. Perhaps they keep their expertise in one of them. But maybe we'll get sympathetic hearing in Glasgow then. Good to know.
What I can see on my screen is that Rose has her hand up.
Yeah, perfect. Thanks, Rose.
Hi, thanks very much, Susie. Really, really interesting talk. I had a specific question kind of on the routine data aspect, which obviously great interest for my PhD, but so you talked a lot about the ethical issues of including older adults in research, particularly around consent and capacity. I guess, do you think that using routine data can overcome some of these issues, or do you think there are specific issues we should be thinking about for care home residents, some of whom, or a large number of whom, may have cognitive impairment, dementia? And also, do you think we collect enough routine data in care homes that we could use for research, or do you think that that's something that we could also should be thinking about and focusing on to kind of improve the volume and quality of routine data that we do collect?
Excellent questions, both of them. So in terms of using routinely collected healthcare data, that does give an opportunity for people who lack capacity or who don't consent to participate in research for a range of reasons to participate if they want to. I mean, I think that it's interesting that the NHS says we've all given our consent for the sharing of our data because it says it's, on an NHS website somewhere that nobody's ever read and you haven't opted out. I mean, people have the opportunity to opt out if they're concerned, but in general, most of us don't, which is and are happy to have our data used in that way to support ethically approved research, to do the right thing and to learn new knowledge. And I think that is a good thing. But I don't know, and certainly in the surveys that have ever been done in Scotland, people have been very supportive of that. They're happy for their data to be used. They want it to be used in that way. And I know that Datalock have done a survey about that and showed that in the general community. But probably if you went and asked lots of people in the street, did they think that was happening? They probably wouldn't be aware. Is that an issue? I don't know. But that's not the question that you were asking. But in terms of people who are resident in care homes, so they should have the opportunity to have their healthcare data used in that way the same, but the data that's collected as part of their social care, as part of their being a care home resident. So a lot of the work I've been doing over the last few years with Lucy Johnson and with the Care Home Innovation Partnership and others has been looking at developing a care home data platform. What data is collected in care homes, and that's what I can put the link in the chat to the Ladder report as well as the Geared Up report that I put there. And can and should that be shared and linked with your healthcare data to provide a more useful holistic picture? And of course, that requires the data to be collected in electronic form to allow that to happen, which it isn't in lots of places. But it also requires that similar process of we are collecting this data for your routine care. Can we use it appropriately anonymized, appropriately ethically approved for research purposes? And there isn't an ethical or consent structure in place for that to happen. As I say, when you move into a care home, you don't sign a thing to say you can do that. Lots of different electronic care software providers are used, and so there's a lot of complexity around that. And the DACHA study that Jenny Burton in Glasgow and many others who may be on the call as well were involved in was looking at the development of a minimum data set that could be collected by care homes that then ultimately could be shared. But even for that large research project to share data was incredibly complex and went through large ethics and governance hurdles similarly. So I think it would be an important part of the picture. I think we need to take people along with us in the discussion about this, that people need to understand that this information can be used in that way, and we need to find out what people think about that. So that's part of a piece of work that I'm doing just now actually, is to see what residents, families, staff think about the use of data for research, because there's using it for care planning, and then there's using it for research purposes, and then there's using it for things like service planning, isn't there? In COVID, they return frequently, their staffing levels, their complexity of care and so on, that allows care staff to plan their staffing levels and what they do as well. But of course, remember, care homes are businesses, many of them, and then some of them are health and from the Health and Social Care Partnership as well. So it adds a layer of complexity around whether data might be sensitive in a commercial sense. So there are additional complexities to think about, I think.
Yeah, thanks, Susie. That's
long ramble. Sorry.
No,
It's
a really great answer. Yeah, thank you.
I don't see any other hands up, Terry.
No, I think we're getting close to the hour. So a last call for any questions, and I'm not seeing any. So it just remains for me to thank Susie for a really informative talk. Thank you all for joining and for engaging with the session and for engaging with all the sessions that we've done in this week. We're going to take a break for the summer, but we do hope to come back with more webinars, and we're in listening mode. So if you have topics that you would like to have a webinar on, then really do please get in touch. You can get in touch with us through the NRS Aging website. And with that, I will bid you all a very good day and a good summer. Thanks, everyone. Bye for now.